US. I'm Dr. Abigail Chi, a nurse by profession and currently practicing as a public health consultant. I'm on Radiant Parenting. This is a beautiful program that is working out to impact generations. And I encourage you to watch it and learn lessons out of it for parenting, which will be helpful for this generation and generations to come. Please like, share, and spread the news out to your friends and relations so that they will always be watching to be getting the tidbits that are necessary for essential parenting. Let's make parenting radiant to the glory of God.
Opportunity presents itself. If you are having your menses and you are in pain and you look morose and your child comes to you and asks you, "Oh mommy, why are you looking like this? Are you okay? Is everything okay? Are you sick? Should I do something for you?" Normally that's what they do. That is an opportunity. You grab the opportunity. You let her know that I am having my period and I'm in some pains, but I am managing it. When you do that, she knows that you also have period. Yes, so that will break every barrier about talking to you about her menstrual issues. When she is having her menses and there is an issue or there's something she wants to talk about, she will remember that, oh, when you had your issue, you told her, so she can also confide in you. But when you don't talk to her about menses, maybe you actually taught her how to use her pad, you told her that she'll be having her menses, but you never even told her that you too have been having menses and you too have been having pains and all those things. She will not be able to open up to you. So we have to be able to open up to our children, make them understand that whatever it is that they are about to go through, we have been going through it for number of years. We've been going through it since our teenage years till now.
Hello viewers, this is Radiant Parenting. My name is GIFTY. You are most welcome to our program. We are glad you have joined us. Today we are looking at the topic, children and dental care. As parents, we are oftentimes concerned about the dental needs of our children, and sometimes we wonder whether we are taking the right decisions. Today in this house, we have brought in a surgeon to take us through how we can meet the dental demands of our children so that we can give them the best in the way they take care of their teeth, the best in the way we meet their routine demands of dental care. Before we continue any further, we'll go on a quick commercial break and we'll come back to introduce our guest to you. Thank you.
Opportunity presents itself. If you are having your menses and you are in pain and you look morose and your child comes to you and asks you, "Oh mommy, why are you looking like this? Are you okay? Is everything okay? Are you sick? Should I do something for you?" Normally that's what they do. That is an opportunity. You grab the opportunity. You let her know that I am having my period and I'm in some pains, but I am managing it. When you do that, she knows that you also have period. Yes, so that will break every barrier about talking to you about her menstrual issues. When she is having her menses and there is an issue or there's something she wants to talk about, she will remember that, oh, when you had your issue, you told her, so she can also confide in you. But when you don't talk to her about menses, maybe you actually taught her how to use her pad, you told her that she'll be having her menses, but you never even told her that you too have been having menses and you too have been having pains and all those things. She will not be able to open up to you. So we have to be able to open up to our children, make them understand that whatever it is that they are about to go through, we have been going through it for number of years. We've been going through it since our teenage years till now.
Welcome back from the commercial break. Today we have our guest in the house. He is in the person of Dr. Solomon Abuaji Ado. He's a married man and blessed with 3 beautiful children. He is a dental physician and an orthodontist in training. Today he's going to take us through children and dental care. Dr. Solomon Abuaji Ado, you are welcome to Radiant Parenting.
Thank you very much.
We are honored that you had time you honored our invitation. We are glad you honored our invitation. Welcome.
Thank you.
Good. So, children and dental care, what should we be concerned about? What should we pay attention to? What is it all about? Can you please tell us?
Yes, regarding the dental health of children, there are a lot of things that we need to consider. And before I proceed, I would like to give a brief introduction about the stages of dentition. So when a child is born, often than not, they have a toothless mouth. It's on the gum that we do see. But in some cases too, we do have people who are born with a tooth or maybe 2 in the mouth, which we call the neonatal teeth. And that teeth is not there are superstitions around this, but I want parents to be calm when they say something like that. It's not much of a problem. Yes. So the teeth will start developing. The deciduous or the baby or the primary teeth, they start developing at like 6 months old. Then we see the eruption of the teeth into the mouth. Regarding the eruption, that is where we have this teething phenomenon. The child may be easily irritated. They often do cry a lot. There are times they drool, and there are signs of teething. They may even run temperature, which is quite a feature or a symptom that accompanies teething phenomenon. It's a normal physiologic process, so parents should not be too alarmed when the children are having teething issue. Beyond the teething issue, we have the development of the primary teeth. That's the baby teeth, or let's call it the deciduous teeth, and it's also associated with teething phenomena. The baby teeth or the primary teeth, they are 20 in number. We give this nomenclature to them, A to E, in each quadrant. So when the baby teeth fully erupt into the mouth, we have a lot of concerns how to handle the health issues as far as the mouth is concerned. So we'll talk about, we have some, I'll group it into developmental anomalies that we may observe and what can be done about the developmental anomalies. Then we also talk on briefly on caries, which is cavity formation. Then I'll also touch on briefly about some irregularities or the arrangement of the teeth. Then I also make mention of what to do when there is trauma to the teeth. I think a lot of Ghanaians, or not even Ghanaians, a lot of people across the boundaries of these nations as well, they have little idea on how to even handle trauma regarding with respect to dental issues. So on the developmental anomalies in children, we do observe some few anomalies that I believe if it is seen early, we can really address it and it will not give much of a problem. We have what we call the anomalies regarding tooth size. We have anomalies regarding tooth size. In that case, what we see is the size of the teeth relative to the jaw size, they are very, very, very small. And yes, they are small. Oftentimes, it's a normal feature when for the for the mouth of for the mouth that has deciduous or primary teeth in it, it's a normal feature. But as the child is growing and losing the primary teeth or the deciduous or the baby teeth, and the adult one is coming, we realize that some of these spaces tend to close. But where there's developmental anomalies with respect to the tooth sizes, we can observe that some of the teeth may be smaller than the average or smaller than the rest. We also have the anomalies with relation to the tooth structure itself, which may even predispose an individual to early cavity formation. Then we also have the aside these few anomalies, we do even have anomalies regarding the shade of the teeth. Putting this aside, that's not a crux of the matter over here. So we can look at the development of caries, and that's also another thing that we have to look at. Then I also look at trauma. With respect to the development of caries or cavity in the mouth, we are looking at some factors coming into play to bring about cavity formation. What factors are we considering over here? One, we are looking at the substrate, that's the food particles that will be on the surface of the teeth. We are looking at the organism, that is bacteria, which is normal flora. If we say normal, there are normal bacteria in the mouth, and they act on the food particle. And we are looking at the factor of time. So the surface, the structure, the quality of the tooth substance, then the bacteria in the mouth, then the substrate, and of course the factor of time is also important, because all these things they interplay to bring about cavity formation. So anytime an individual takes in food, what happens is if the individual or the child, if the child's teeth is not well brushed, what happens is there will be particles of food on the teeth or debris on the teeth. And what happens is the organisms in the mouth, that's bacteria, what they do is they act on the substrate, oftentimes the carbohydrate substrate in the mouth. And when they act on the carbohydrate substrate in the mouth, they decompose it, or out of their metabolic activities, they end up releasing, breaking down the carbohydrate to the point that we may have acid content being expressed onto the tooth surface as a result of the activities of the bacteria. So I mentioned the factor of time. So if the acid is poured right there and you intervene by good brushing, washing, rinsing the mouth, then you can be sure that it will not be much of an issue. But if it is not addressed as soon as practicable, then the acid will have ample time on the surface of the tooth to bring about demineralization. And this demineralization, that also creates avenue for further food particles to pack into these micropores, and the cycle continues, and it brings about cavity formation. So it starts regarding the cavity formation, it starts within the enamel. And the enamel oftentimes is sensitive and doesn't have any nerve components in them. The point is, we don't experience pain at that time. So that is why the child may have cavity formation at the early stages, but because he or she is the things that are happening in the mouth and do not pay much attention to it. The cavity, what happens? The cavity that has been formed in the enamel, food particle packs in those cavities, and further decomposition takes place. As I indicated earlier, the cycle dentin layer, and the dentin is the sensitive part of the tooth. So when it gets into the dentin layer, there we have the dentinal tubules, which is filled with fluids, and this fluid can oscillate or vibrate at temperature. It can be irritated by temperature and fluid dynamics, such as concentration, be it saltiness or sweetness in food. Attention is also not paid to it. Then there will be progression of the cavity from the dentin to where we call the pulp chamber in the tooth. So the pulp chamber is actually a cavity or a space area where the blood vessels, the nerves, the lymphatics are present. And because the nerves are there, when cavity extends into that place, what happens is now we have food particles getting into the cavity, and because it has free access into this nerve region where the blood vessels are I've earlier indicated that there are bacteria in the mouth, access into an inflammatory reaction. So the inflammatory reaction that they incite, it triggers pain. Initially, it may be reversible pain. It may be reversible, we call it reversible pulpitis, and it comes out as sharp pain, which is triggered by something. It is triggered by a stimulus or a stimuli. But if it is not addressed at that early stages, it then progresses and gets into the realm where we call the irreversible pulpitis. At this stage, the pulp is more bacterial infection setting, and it can predispose the child to what we describe as dental alveolar swellings. So the swelling is like because infection has stayed in the pulp for a very long time and unattended to, chances are that the infection tooth or teeth, the question is, has their gait been affected? If their gait has been affected, the way they walk has been affected, you can see that this is not the normal way the child was. Maybe he's stooping, maybe he's stumbling into the pulp, which we describe it as complicated fracture. So the first one is enamel fracture. Then we have the enamel dentin fracture. Then we have the complicated crown fracture, and also we can have the roots getting involved. It may be involved as a result of the trauma. The roots also may be involved. It may be involved as a result of the trauma. The roots also fractured, and all of this thing we need to pay attention to it. And when you get to the dentist, in the event there is trauma, the dentist can be of tremendous help to you. There's this when a tooth fracture, as much as possible, if you have the fragment available, the broken piece available, we do not discard it because it can be a vital component that the dentist can use to restore your child's teeth to normalcy. The tooth that has been fractured, let's be able to find it too. It's not a hopeless situation. We have various restorations, composite restorations that we can apply onto the fractured tooth, and so doing, we can restore your child's teeth to normalcy and to original beauty. Of concern to me has to do with how we are bereft with knowledge when it comes to abortion. That is, if the tooth should come out of the bone as a whole, the tooth is out of the bone as a whole, the root is there intact, what are we supposed to do? Because it's one of the common events at home when children are playing and having good times. So when it happens this way, what you have to do is you have to pick the tooth, but hold the tooth at the crown. Do not hold the tooth by the roots. Yes. I repeat that again. In the event a child is playing and some way, somehow, accidentally, he had a knock on the teeth, and the teeth falls out of the socket or out of the bone. What the caregiver or the parent ought to do first is to hold the tooth by the crown and not the roots, because we have important cells on the roots of the tooth that we will need that cells to help to reintegrate the tooth. When we put the tooth back into the socket, we need those cells to be viable to reintegrate or to work out a healing process so that the tooth does not completely die. So in the event it is compromised, that is if parents go by handling the roots of the tooth and not the crown, that is where we may have periodontal tissue compromise. And when that happens, chances are that we may end up losing the tooth. The time between what we call the extra-alveolar time is a very, very important time. That is the time between that when the tooth got out of the socket or out of the bone, and at time we get the tooth put back, a very good medium that can transport the child to the nearest dental facility without causing problem to the tooth. Another medium you can consider by way of transportation is milk. If you have milk available, what you can do is you can put the tooth in milk, and it can also stay the periodontal tissues viable till a dental attention is sought for. So that one too must take notice. If you don't have the boldness to plant the tooth in the socket, you can have a cup of milk, drop the tooth gently in it. It's nutritive to the periodontal tissue, and chances are that they will not die off. Then again too, we can also look at even the patient's own saliva. It's also a good transportation medium, though it may look disgusting a little, but it's just for a brief moment, just to get the specialist's attention, or the child will be able to get the necessary assistance from a professional. So basically that is for the business. We have various habits among children. We have the tongue sucking habit. Sorry. You have the tongue, the sound. It becomes very difficult for the child to pronounce those words, and also obviously appearance may be affected. That is understand when they are children. As I indicated, some of these things can be prevented. If you don't prevent it at that early stage, that's during the childhood stages, they grow with it. So when they grow into it, they may end up lisping. Whenever they are speaking, you realize that there's a lisp in the way they speak. It's not their pronunciation is not so perfect, it's not so accurate. And for that matter, there's a need to pay much attention. Habit as it is, it doesn't look so troublesome, but over a long period of time, it has its own dental implication on the teeth for a child. So we have to be on the watch out as parents. If our children are in the habit of tongue sucking or digit sucking, tongue thrusting, we have to be very, very, very careful, and as soon as practicable, put in the necessary intervention to intercept those habits, so that it doesn't become something which is more aggravating. Or
brushing the teeth, how many times should he do that in a day, and for how many minutes should he spend brushing the teeth? Well, sometimes in no time to say we are done, and then they are off.
Yes, that's children for you.
Mm-hmm.
Yeah. So when it comes to brushing, of the teeth, it is recommended by dentists that we brush twice. But I know people are doing it once a day. It borders on preference. Some dentists even do it once a day. But it's not about the frequency, but it's about how well the cleaning is done. If I'm able to do it once, and I'm able to clear all the plaque, all the bacteria out of my mouth, I think I'll be fine. So that is it. And regarding the duration, some can do it in a short possible time, but they can do it well. Others too, it may require of them to have ample time. So let's not rush it. I can't put specific time to it. But the point is, let's not rush it. Let's be diligent. Let's be diligent about it and do it appropriately. And by so doing, I'm pretty sure that we'll be freed of what we call the plaque. Regarding on the plaque is just like a soft foam or particle on the teeth. It is easy to clean with just brushing. It is easy to clean with just brushing. Good brushing is easy to clear the plaque off. I'll use this analogy, like a mason who is plastering a wall.
Okay.
The mortar you apply to the wall, within that short period, it is soft. You can even wash it off.
Okay.
You can brush it off. You can use the broom to sweep on it with water, and you'll be able to wash all the mortar that you've applied. Or two.
Another occasion, we'll let you come here and teach us how to brush our teeth properly. I think that would really help us. Then you spoke a lot about when the tooth falls off, how we should take care. You use a term for it.
Aversion.
Avulsion. So you mean it is wrong if the tooth falls off and I put it in a tissue? It is wrong.
It's absolutely wrong because even when you put in a tissue, what's happening? You are drying the surface of the root. So you are taking water, which is the viable component or that element that would prevent, let me call it, those periodontal tissue from getting testy and die. You are preventing that, something like that. To the layman, I'll put it that way. You are preventing the dehiscence or dryness of the root. And if you put it in a tissue, it dries it and it will kill the periodontal tissue of cells on it.
Okay.
And when
Okay. Then you also mentioned about diet, what the children eat. So it means that when we give them too much sweet, we are not helping their dental hygiene.
yes, sweet is actually sugar. And what the bacteria does is, in the mouth does is, what the bacteria do in the mouth is they act on the sugar, they break the sucrose down into basic components, including acid. And I use this analogy. Should I apply acid on a metal surface, it will corrode it.
Yeah.
So acid corrodes the surface of the tooth
Yeah.
and brings about micro pores, very, very minute pores that is not visible to the eye, but over a long period of time, it develops into various cavitation of various sizes. So
That's great. So when our children are younger, you mentioned that some come already with neonatal teeth.
It's not much of a problem. What happened? The only difficulty with this is when it comes to breastfeeding. That's why I use the babies with sharp teeth. Babies with sharp teeth. Yes, so they end up biting on the nipple and it can irritate the mother and pain and all that.
That's a challenge.
So it becomes breastfeeding becomes a little difficult. Mother is hesitant because of the fear of bites from the babies with sharp teeth. So that's when you go to the dentist, we're able to bevel or we smooth it, we contour it so that it doesn't become that sharp.
Should we clean their mouth and with what? Because when I gave birth, I was told that when they are growing up, we start giving them cocoa and so should use